Finals SAQ55 Sedation. You are asked to sedate a frightened adult patient for insertion of dental implants in an outpatient dental chair. A. Complete the table in your answer booklet with the 4 levels of sedation in the ASA continuum of sedation and clinical features seen at each level. During minimal sedation or anxiolysis, responsiveness, normal response to verbal stimulation, airway, spontaneous ventilation and CVS function unaffected. During moderate sedation or analgesia, purposeful response to verbal or tactile stimulation, airway, no intervention required, spontaneous ventilation adequate, CVS function usually maintained. During deep sedation or analgesia, for responsiveness, purposeful response following repeated or painful stimulation, airway intervention may be required, spontaneous ventilation may be inadequate, CVS function is usually maintained. During general anesthesia, patient is unarousable even with painful stimulus, airway intervention is often required, spontaneous ventilation is frequently inadequate, CVS function may be impaired. B. Outline drugs that may be used and their methods of administration when providing sedation for this patient. Options include Antonox via inhalation, temazepam via oral route, midazolam via IV, oral or intranasal route, small single-dose fentanyl via IV route, wait until peak effect. This may be followed by cautious IV midazolam titration. C. What are the best practice principles for providing safe sedation in this patient? Environment, adequate monitoring, equipment, resuscitation facilities and drugs, and reversal agents. Suitable area for patient recovery. Staffing, staff trained in ALS, sufficient staff to monitor patient after procedure while recovering from sedation. It is helpful to have an anesthetic assistant. Patient consent with written information detailing what is conscious sedation, options available and associated risks. Patient selection or pre-procedure assessment, assess for comorbidities, patient in agreement with plan. Note that sedation in elderly may produce paradoxical disinhibition and agitation. Peri-procedure management, monitoring such as NIBP, capnography, oxygen saturations plus ECG if indicated by patient morbidities, supplementary oxygen, presence of IV line, minimal sedation necessary, ideally just Antonox with careful titration of dose, allow each dose to reach peak effect. Opioid administration only if pain is likely to be a significant feature of the procedure that cannot be managed with local anesthesia alone. Discuss with dentist. Use only small doses of short-acting drugs such as fentanyl. Communication is reassuring to the patient and allows monitoring of their conscious level. Post-procedure care, suitable area for recovery with member of staff trained to care and monitor such a patient. It may be appropriate for anesthetist to remain with the patient. Discharge to care of responsible adult who will escort patient home and remain with them for 24 hours. Discharge only to take place when patient is orientated and observations are stable. Written information to be provided regarding complications, advice to not drive or operate machinery and make important decisions for 24 hours. Contact numbers for advice and what to do in an emergency. Clinical governance, audit, education and training. Staff competencies in all areas of practice should be maintained, such as resuscitation and recovery. Critical incident reporting and analysis when appropriate. Chairman report, 62.1% pass rate. This is an important topic and was generally well answered despite some confusion caused by the inclusion of a table that required completion. Additional information. Sedation refers to the use of drugs to produce anxiolysis, analgesia and a degree of amnesia to allow patients to tolerate uncomfortable treatments or investigations without resorting to general anesthesia. Based on the ASA classification, during minimal sedation is a drug-induced state during which patient responds normally to verbal commands. Cognitive function and physical coordination may be impaired. Airway reflexes and ventilatory and CVS functions are unaffected. During moderate sedation or conscious sedation, this is a drug-induced depression of consciousness during which patients respond purposefully to verbal commands, either alone or accompanied by light tactile stimulation. Reflex withdrawal from a painful stimulus is not considered a purposeful response. No interventions are required to maintain a patent airway. Spontaneous ventilation is adequate and CVS function is usually maintained. Monitored anesthesia care or MAC does not describe the continuum of depth of sedation. Rather, it describes a specific anesthesia service performed by a qualified anesthesia provider for diagnostic or therapeutic procedure. Indications for MAC includes the need for deeper levels of analgesia and sedation than can be provided by moderate sedation, with potential conversion to GA or regional anesthesia. During deep sedation or analgesia, this is a drug-induced depression of consciousness, during which the patient cannot be easily aroused, but respond purposefully following repeated or painful stimulation. Ability to independently maintain ventilatory function may be impaired. Patient may require assistance in maintaining patent airway. Spontaneous ventilation may be inadequate. CVS function is usually maintained. During GA, this is a drug-induced loss of consciousness, during which the patient is not arousable even by painful stimulation. The ability to independently maintain ventilatory function is often impaired. Patients often require assistance in maintaining patent airway, and positive pressure ventilation may be required due to depressed spontaneous ventilation or drug-induced depression of neuromuscular function. CVS function may be impaired. As sedation is a continuum, it is not always possible to predict how an individual will respond. Hence, practitioners intending to produce a given level of sedation should be able to rescue patients whose level of sedation becomes deeper than initially intended. Rescue of a patient from deeper level of sedation than intended is an intervention by a practitioner proficient in airway management and advanced life support. It is not appropriate to continue the procedure at an unintended level of sedation. Thank you.